At this point, some of you may have decided to undergo bariatric surgery for a healthier life and a better lifestyle, but are still worried about the costs of this surgery. Let me guide you today on how bariatric surgery and medical insurance work together. I'm Dr. Jaydeep Palep, and today I'm going to discuss the nitty-gritties of Mediclaim or insurance, the eligibility criteria for insurance, and what are the factors that influence the cost of a bariatric procedure. Just a few years ago, bariatric surgery was considered as a cosmetic procedure. However, bariatric surgeons and their patients, many of them from across the country, filed lawsuits against all the insurance companies possible in our country, in India. And finally, the Supreme Court gave a landmark ruling in favor of the patients and put bariatric surgery or classified it as a metabolic procedure, which was essential, which was life-saving and life-changing procedure and not a cosmetic procedure. And this ruling made the IRDAI, the Regulatory Insurance Authority of this country, get all insurance companies on board to offer medical insurance for bariatric surgeries thereafter. So how does one qualify for medical insurance coverage for a weight loss procedure? The first and foremost criteria being that you already need to have an existing Mediclaim or a medical insurance which is in force for at least more than 3 years. Before I dive into streamlining the process of medical insurance for bariatric surgery, let me tell you, I as a bariatric surgeon operate out of different hospitals in the city. What it does is that it allows me to tailor-make the procedure, the costing of every patient irrespective of their financial background and give you the maximum benefit and avoid any hindrance in your access to healthcare or for a bariatric surgery. Claims can be a very daunting task to get when you're applying for one, especially for bariatric surgery. What you really need is good documentation, which means proper medical records available with you already, a strong consultation note by your bariatric surgeon, the preoperative tests which are needed for this kind of a procedure, which clearly demonstrate that you are in need of this particular medical procedure or a medical intervention in the form of a metabolic surgery or a bariatric surgery, and all these things going simultaneously to the medical insurance company will ensure a smooth process of getting an approval for the claim of your surgery. For Indian patients, to apply for a claim for your bariatric surgery, what's most important is to finalize a date with your surgeon and apply exactly a week before the date of surgery so that the claim goes through the medical insurance company, and usually your approval comes within a day or two. 24 to 48 hours is all that is needed. But in case if there is a query raised by the company, I as a bariatric surgeon should have enough time to reply to that query and make sure that your claim process has been approved by your insurance company seamlessly before your day of admission for your surgery, which is normally a day prior to the date of surgery. Now, let's talk about the cost of bariatric surgery. This can differ from patient to patient based on the patient's profile, the type of procedure chosen for the particular patient, the way I'm doing the procedure, whether it is laparoscopic or robotic, and finally, the hospital that you choose to do the procedure at. So how do these factors affect the cost of bariatric surgery? It depends on the patient profile. What is the patient's profile? The age of the patient, the BMI of the patient. The higher the BMI, the more chances of the patient having other medical illnesses. Also based on the procedure. And finally, the last factor which I addressed earlier on is the hospital that you will choose to perform this procedure or undergo this procedure. So bariatric surgery, which was once considered as a cosmetic procedure, now known also as a metabolic surgery, is a life-saving and a life-changing procedure for you. And if you are going to embark on your journey of weight loss, proper planning, sitting with your bariatric surgeon, discussing all the nitty-gritties and selecting the hospital of your choice, making sure that your family and friends are on board with the decision, and finalizing all the points that we have discussed with your bariatric surgeon, then going on for the procedure is going to give you the best outcome. So in case you have any questions, any doubts with respect to your procedure, your insurance concerns, feel free to write in the comment section below. Like, share and subscribe to my channel. This is Dr. Jaydeep Palep, bariatric and GI surgeon from Mumbai, India, signing off today.